Hello, my name is Benedicta Wong, and I'm a periodontist from Melbourne, Australia. Thank you for joining me today as we discuss the replacement of an ankylosed maxillary incisor, specifically the management of hard and soft tissue deficiencies to provide a patient-centered outcome. Dentistry today, we know we practice in a very different environment to what we were practicing in maybe 15, 20 years ago. Our patients are constantly bombarded by social media, so there is a lot of high expectations amongst not just our patients, but also amongst ourselves, clinicians. So that when a patient shows up like this to our rooms, there is an expectation to transform their smile into something that looks like this. So there are a lot of challenges that we face when replacing single maxillary incisors. Specifically, if there is pre-existing pathology, it makes it much more challenging to recreate the natural gingival architecture, maintaining the interdental papilla, mimicking the texture and the color of the normal mucosa, and most importantly, achieving symmetry as if the natural tooth is still present. Most importantly, what we would like is to achieve long-term stability for our patients. So let's have a look at the problem that we face. So we have a young female. She was 28 years old when she came to see me, and she has a fractured upper left central incisor. She suffered a traumatic incident. She fell off a bicycle at the age of 12, and you can see not only had she fractured her upper left central, her upper left lateral incisor also has a little chip. The 2-1 was decoronated when she was 15 years of age, and she was wearing a flexible acrylic partial denture pretty much from then.